Right, in this video, I'm going to talk about basically talking to your doctors when you have ADHD. And the reason for that is because, well, not just from what I've experienced, but from what I've heard of others, it's a very daunting situation, even just talking to doctors about ADHD. I mean, that's the same about pretty much any condition that people have. Some people are alright with it and very outspoken and very straight to the point or candid with what they want to discuss when they go to see their GP or any kind of doctor or psychiatrist. And then some people, myself included, can be a bit withdrawn or a bit anxious or even embarrassed at times to talk to a GP or a doctor. And the reason for that is because regardless of whatever condition you have, but in this sense specifically I'm going to talk about ADHD. When it comes to ADHD, because of the aspects that kind of come into play when it comes to things like common sense or daily routines or the differences between what a neurotypical person would do or think or say or act and what a person who's neurodivergent or has ADHD and how they would say something or what they would do or think or act and so on. When it comes to those differences, it can make you feel very out of place, very outcasted, very unusual, abnormal. And honestly, these days, I'm perfectly fine with being different, but with being abnormal or accused of being such. I don't care, you know, I'm fine with who I am. I choose to be that way, and to be honest, I think it's better to be a little different than to be whatever most people consider to be normal, because then, you know, at least you have something more to offer in a conversation or in an interaction and that kind of thing. But when it comes to this, I can understand that can make you feel very, very isolated and very unhappy and even depressed at times because you don't know where you fit in and you don't know where you belong. So when it comes to talking to your doctors, that can come into play as well, and that's the part that makes it feel a little bit awkward or a little bit embarrassing, and that's just what I want to talk about. So the first thing I want to say is each of these videos is going to be a specific tip, I suppose, on how you should be when you talk to your doctors, or how I think it's most helpful to interact with them. Now, first and foremost, your doctor, your GP, they're not there to judge you, okay? They're there to help, they're there to offer advice, they're there to try and understand not just you, but your diagnosis, understand your symptoms, understand how they affect you on a daily basis, as well as you as a person, and how that in turn gets affected or can affect the symptoms, because it's not a one-way street, you know. The way you are will affect how you interact with the world, but the diagnosis and the way your brain works will affect you as a person. It's so complicated, but at the same time, you know, it's well worth the time to just consider. And when it comes to doctors, just be straightforward, you know, be very candid with what you tell them. Don't hide anything. Don't feel embarrassed. Don't feel out of place, because again, they are literally there for it. And sometimes even doctors can be a little bit, I know it can feel very formal, and sometimes, in my case anyway, when I'm in a very formal situation, say with a counsellor or a psychiatrist, I feel a bit put off. It doesn't feel natural. I don't feel comfortable. Now, I know that that's how it can feel, but at the end of the day, it's their job. They're trying to find the best method, not just interacting with you, but to give you advice that you will take on board and will work for you. So, like I said, just be straightforward. Just be open with them, you know. Don't be embarrassed, because they probably heard it all, and even if they haven't, then there's just something else for them to add to the repertoire of things to look out for future patients, you know. And yeah, I think that's all I need to say on that point. So in this video, it's just about that's all I wanted to talk about. Just be open, be candid, yeah, be very straightforward with how your daily life is going and how the symptoms are affecting you, what you think is worse, what you think is better, and I'll just sort of dissect all of that in more specifics later. I'm in a bit of a rush today because I have not an appointment, I have a class later tonight, so I can't do a long video. But anyway, so that's all I wanted to say. Now, if you like the video and you want to see more, then please leave a like, follow. If you have any questions or requests for future videos, please put that in the comment section, because, you know, that's what's there for. Put your thoughts, opinions, and anything I said, you know, experiences, if you feel comfortable enough to do it. And subscribe to the YouTube channel and repost the video. And that's all I got to say today. So aside from that, have a great day, and hopefully I'll see you next time. Till then, see ya, bye!